Hello, I'm Sandhya Seshadri from the University of Rochester, and I will be presenting our study, Are We Providing Adequate Palliative Care for Parkinson's Disease? Patient and Family Perceptions. Indeed, it's a privilege for me to represent our multi-professional team of physicians, nurses, researchers, implementation scientists, and professionals across 3 institutions and 2 time zones within the United States. This study was part of a 3-year project funded by the Patient-Centered Outcomes Research Institute to implement outpatient palliative care for the Parkinson's Foundation Centers of Excellence. We operationalize palliative care to include 5 key components. First and foremost, the systematic assessment and management of non-motor symptoms, of patients' grief and demoralization, of care partner needs and support, and in addition, annual advanced care planning and timely referral to specialist palliative care and hospice as appropriate when needed. So between September and December of 2021, we sent out this survey to 12,995 patients and care partners who had given their consent to be sent surveys through the Parkinson's Foundation. I want to now share some of our results. Who took part in our survey? So we had roughly about 1,882 people who responded to our survey. These were 1,266 patients and 616 care partners. So with regard to the first aim on the extent to which people's palliative care needs are being met, we found that non-motor symptoms, particularly the most bothersome symptom, was being addressed pretty well across the board. But however, pain management was not addressed as robustly as other non-motor symptoms. We also found that advanced care planning was being done to a lesser degree. And with regard to timely referrals to hospice and palliative care, we should point out that most of our respondents, especially the patients, were all people, many of them had been diagnosed with Parkinson's disease less than 10 years ago. So it is appropriate that maybe these discussions on palliative care and hospice were not happening as often as we would see otherwise in the general population. But the interesting thing in our finding was that any item related to either patient grief, demoralization, care partner support, emotional needs, these were not addressed as robustly as those of the non-motor symptoms. And this actually ties in very well with our questions on the communication effectiveness. We found that while 69% of patients and care partners felt their doctors really made them comfortable about asking questions, and 64% of the patients felt their communications were open and honest, few actually felt that their conversations on how to cope with emotions, with fears or stress, were really not very well addressed. And in fact, only 25% of patients felt that doctors did an outstanding or very good job with that. Since the perceptions of adequacy of palliative care received may be actually influenced by how much people really know about palliative care, we did assess for how much do our respondents know about or have knowledge about palliative care. And in response to this question, we found that actually more than half of them said that they knew at least a little bit about palliative care. And most respondents felt that the goal of palliative care is really to be able to provide patients and families with support for dealing with this illness. Very few of them actually associated palliative care with either death or giving up. Our study certainly has many limitations, and our sample basically comprised people with higher education and more income. So these findings may not really relate to those with less. However, we really feel that even if those with higher income and education are not getting enough palliative care support, then it could potentially mean that those with less are getting even lesser. We found the answer to our question, are we providing adequate palliative care for Parkinson's, as a yes and maybe. Among our key components, non-motor symptoms are being addressed. However, in areas related to emotional and spiritual support and in terms of care partner support, there definitely is a lot of work that needs to still be done. With widespread recognition and evidence that palliative care for Parkinson's disease leads to better outcomes, and the findings from our study that show distinct opportunities for better care, we have much work ahead of us to not only provide adequate but excellent palliative care for Parkinson's disease. Thank you.
Thank you very much for that. I wondered, any questions again, put them into the right side of the screen on your screen. But I'll start. It seemed that the patients and families were quite happy to talk about palliative care, but the neurologists weren't. How do we get over that?
That, that is something that we have constantly been working with on our larger project also. And I think one of the most surprising findings was that even if our sample comprised mostly people who are more educated, they definitely seem to understand what palliative care is. And the resistance in our qualitative interviews, which is not reflected in this study, both with providers and with patients, is that on the provider end, physicians are hesitant because they think that patients are going to get scared if you bring up the word palliative care. And on the other hand, patients and families have constantly, when we have talked about it, have said initially a little bit of resistance, but when we explain what it is, they are more than excited to bring it on. I think so far I've had only one patient to date who has said he's not yet ready for it. So I think the main message would be to not be afraid to engage in these conversations and set them in the context of what this whole conference has been, which is about talking with love and compassion. I don't think anyone would resist that.
I mean, interesting, in Europe, we had a similar, that neurologists were resistant to, but patients and families were very small resistance to having palliative care. And and this may be an educational activity to show to neurologists that patients and families aren't going to be very frightened and run away.
Yes, and I think part of that also ties into the earlier, speakers who had mentioned about education to neurologists on talking about difficult emotions. It's a hard thing to bring up. So to set it in the context of where, it's our shared humanity. This is where we're all going to end up. So why not talk about it openly?
Does it also show a problem, a challenge to have a more multidisciplinary approach within clinics? That if there were nurses and social workers and chaplains there, they may be able to answer or discuss some of these issues. Does that happen? Did that happen was that discussed in any of your participants?
In the surveys, we did not directly ask about this. In our qualitative interviews, we certainly have. And one of the things in the survey we found that was the referrals to chaplains and social workers was definitely not as frequently happening. But definitely, I think the interdisciplinary approach has been a part of our entire big project. And we're trying to bring on as many social workers, nurses, chaplains into the mix. I think it's been an interesting conversation, both with neurologists and team members. And definitely, I think a team-based approach will take some of that anxiety out of the conversation.
There's one question just come up about whether they're valid because of the group of people who are answered, but I think that's a problem with any surveys like this.
Yes.
Thank you very much indeed.
Thank you.